Today we're joined by Dr. Nikki Ariaratnam, a breast imaging expert, here to clear up common myths and explain why your mammogram matters now more than ever. Good morning, doctor.
Good morning.
Thank you so much for joining us today. Now, why are annual mammograms important for breast health?
Annual mammograms are so important for breast health because mammograms allow us to detect breast cancers when they're very small, and that means that we usually can treat them very easily.
Now, what are some common misconceptions that you hear from patients about mammograms?
A lot of times patients are worried about how much mammograms hurt. That's because the breast does get compressed between two paddles, but we've done a lot of improvements over the years to try and make it more comfortable for our patients, including curved paddles and an auto release function, so you're really only in compression for a few seconds. Another common misconception is that patients are worried about radiation from the mammograms and that causing them some harm. But really, it's a very, very small amount of radiation, less than what you get in a plane flight. And for the relative benefit that you get from early screening detection, mammograms are worth it.
Now, for women new to screening, how can they take an active role in their health and make sure they're getting the best care possible?
Well, it is really important to go to a high quality breast imaging center. There's a body called the American College of Radiology that creates breast centers of excellence. And that's really important because it means that the center is meeting certain standards for the quality of the equipment that they're using, the staff, meaning the technologist who helps you take the picture, as well as the radiologist reading the mammograms. So I think it's really important where you go to get your screenings done.
Now, what makes a dedicated imaging center different from a hospital or a specialist?
A dedicated imaging center might have other modalities other than mammograms, such as ultrasound, breast MRI. They may also have PET scans or other kinds of imaging equipment on the facility. And what's important about that is that a screening mammogram is sometimes only the first step. You may need to come back for additional views and another ultrasound, and even in some cases, a biopsy and breast MRIs. So it's really very important to try and go to a facility that can take you from the beginning to the end of your breast evaluation by having all of these different modalities of imaging.
That makes a lot of sense. Now, what advice do you have for women who are navigating their imaging choice or putting off getting their mammogram?
I just want to encourage everyone when they're the age of 40 to start coming for their annual screening mammograms every year. Putting it off does not make it any easier when somebody finds a lump or they get diagnosed with breast cancer at a later stage when it actually can be felt. I've had so many patients come to me and ask me when is the right time to start, and I always just tell them 40 is an easy round number to try and remember it. You may want to start a little bit earlier, such as 35 if there's a strong family history. Please do not put off getting your screening mammograms.
Now, where can our viewers go to learn a little bit more about South Jersey Radiology?
You can actually check out our website, sjra.com, to learn more about our providers and all of our locations. And if you have more in-depth questions about mammography and other screening breast studies, you can go to the American College of Radiology website. It's acr.org.
Well, thank you very much for sharing this important and helpful information, and we'll see you next time, doctor.
Thank you so much.